welcome this afternoon to our event, Scotland's Role and Contribution in a Changing Arctic Environment. This event is part of a series of network events supported by the Scottish Government, and we're delighted to be running this as part of a kind of like a piece of work that we've been embracing for some time, and it builds on the Scottish Government's Arctic Connections framework, in which a number of issues were highlighted, part of which is enabling and facilitating collaboration, coordination amongst Scottish higher education institutions and research organisations on Arctic research. And a particular focus of this is encouraging greater engagement with the lens of interdisciplinarity and breaking down silos and working across different faculties and sectors. So we recognise that there are many strengths across Scottish-based institutions in Arctic research, and we have a wealth of knowledge across our landscape. But one of the things that we found is that our activities are often fragmented, leaving us unaware of the brilliant work that's happening across our institutions. So we're hoping that this event will demonstrate and put a spotlight on some of these areas of work, and to facilitate discussion on how we might advance Scotland Arctic research with our Nordic neighbours. So as part of this, I would encourage, as we move on from the conversation, is to really embrace the discussion element of our event today, and you know, being innovative and being creative and thinking through what are the biggest sort of challenges that we face in front of us. So how this has come about, we recognise that our focus on the Arctic is because of the unprecedented scale of the change being experienced in the region. Heat waves and wildfires are now frequent where they were once rare. Shrinking sea ice is driving ecosystem changes. Unique archaeological and cultural records are being destroyed by erosion and decay. Polar communities that have suffered so much in recent generations are facing yet more challenges to their very existence. And this really puts a spotlight on what we're talking about here. It's trying to bring a people perspective to our research and the work that we do. Scotland, being Arctic's closest neighbour, is also impacted by these environmental and climate-related changes. And with similar interests, we have so much to offer in terms of drawing together our efforts, working closely and collaboratively together to discuss those critical issues and fostering these educational links. So the event today is focusing on mental and physical health. And for that, we have a great lineup of speakers. Could I have the next slide, please? So we will have presentations by Scott Graham, lecturer in sports medicine at Edinburgh Napier University, and exercise physiologist with the Polar Academy. Martin Malcolm is head of public health intelligence and information services at NHS Western Isles and project manager in MPA-funded ChatPal project. Professor Anthony Morgan, Dean of GCU London and Professor in Public Health at Glasgow Caledonian University. And we have Professor Arya Rautio, UArctic Thematic Network on Health and Wellbeing in the Arctic. She's from the University of the Olo Group, and we're absolutely delighted to have you all. So what we're going to do is we're going to hear some quick fire presentations from each of our discussants, and then we were going, our panelists, and then we're going to go into this facilitated group discussion. So I will be talking through some of the points that are being raised as part of these conversations and putting a spotlight on some very specific questions. And those questions are, what are the opportunities and barriers to furthering multidisciplinary and interdisciplinary research in this field? How might this research, what might it look like, and how can we ensure that we put a spotlight on the lives and well-being, and particularly the resilience of people in Scotland and the Arctic? what are our strengths? What can we draw on? We recognise that there's a wealth of expertise out there across our landscape, but what are those particular strengths where we can really leverage on and build on to be able to address some of those issues? What are the lessons we can learn and where can we go? So we're really looking at some sort of roadmap for education and research sort of moving forward. So without further ado, what I would like to do is to invite our first speaker, if you're there. Here we are. Yes, slide sharing is perfect. So Graham, Scott Graham, welcome. And I really look forward to listening to your and hearing your insights. So over to you.
Good morning. I'm really glad that you used the term resilience there, although you're using it slightly different context to that I will be using in my research, because it underpins much of the research and the activities that I'm going to talk about in a short presentation this morning. I thought I'd start just to remind us that the Arctic is a beautiful, however, it's a very fragile place. And I also apologise, this is not the presentation that I would normally give. Due to our current circumstances, I would normally be standing. I should have flown out last Friday and I should have been standing just there where I was a year ago in the Northwest Territories, gazing up at the northern sky. However, I'm an exercise physiologist. I practice, I research. My aim and my goals in the Arctic are for people there to develop resilience physically and mentally through the use of the Arctic as a vehicle or a mechanism. I teach environmental physiology and I work with a very disparate and diverse group of people. So if we go on to the next slide, some acknowledgements for co-collaborators and workers. My own institution, Georgius Andronicus, St Andrews, Kip McKinley, the Polar Academy, University of Pittsburgh, Adam Szymanski, Chris Conaboy, and most importantly to the First Nations who allow me to trespass in their lands on the premise that my footprints will not be there for long. Moving on to the next slide. Current circumstances shouldn't dictate what we do, and a lot of us are struggling at the moment because of them. Currently in abeyance, I have 2 North Pole expeditions, one with a Paralympian, one with a paracyclist. I have 3 groups of school children currently waiting to go to their expeditions, and I have 42 athletes who will not be running the Ultra this year. We mustn't forget what we live in, however, we mustn't allow it to determine what we're doing, because it will all come back. Next slide, please. The Arctic is fragile. The current prediction is that within the next 3 to 5 years, we will not be able to cross because of the increasing size of leads because of global warming. So many of the expeditions that we took for granted, activities took for granted in the past, may not happen the way we used to do them. Next slide. Okay, I research, I prepare people for ice ultras. In effect, we take both novices and elite runners, we prepare them 380 or 125 miles from the border, the Yukon territories in northern Canada, to the edge of the Arctic ice. So on the left-hand side, you can see the ice road made famous by ice road truckers. And we run athletes self-supported and research their characteristics all the way up the ice road. Last year was the warmest we've ever seen it, and we had to bring the race back 2 weeks to ensure that the ice was thick enough to drive on. On the right-hand side is the current erosion in the village we finish at in the Arctic Circle, Tuktoyak. Unfortunately, it may become the first community in Canada that is going to be moved from its location and its historical location further down, further south because of global warming. Next slide, please. Our research in the ultra community focuses on resilience to run 380 miles on the ice road self-sufficiently. Our last study, published in AJSS, we measured motivation, mood, sleep cycles, and injury rates. When we discounted training, equipment failure, and injuries, what was very obvious was that this resilience, toughness, the ability to endure is core and intrinsic to success in endurance sport and extremities. Most studies have looked at this factor and have used previously developed strategies from other events. Looking at the Arctic and looking at participation in Arctic events, we now realise that we have to develop new and more sophisticated and very much more tailored to the Arctic psychological tools and measurements to determine people's success in events. Next slide, please. Other research we're conducting is with British and US elite units, looking at how they can develop tools to measure potential success in Arctic conditions without deploying troops constantly to the cold. i.e., what we're looking at is, can we develop psychological skills training, psychological challenges, and psychological instruments of assessment that will determine in country how elite soldiers will perform in the Arctic. We have shown that the factor that is most crucial for success in the cold is this elusive character, resilience. It is not motivation, it is not previous experience, it is not the ability to plan, it is in fact this elusive resilience. Next slide. So, the Polar Academy. I work with elite athletes. We research with elite athletes. I work with elite soldiers. I also work with young people from Scottish communities via the Polar Academy. Polar Academy was set up to allow young people who are disenfranchised, disengaged, but not at risk to further themselves using an Arctic expedition to prove themselves, to gain vital life skills and to gain, in effect, resilience. It was set up by Craig Matheson, 2013, and is a donations-only charity. We select 2 schools a year. My role is to train the young people, advise them in nutrition, medical aspects, cold weather survival, and then to help select the group that will go on an expedition to Greenland.
Scott, Scott, may I just come in here? I'm just thinking with the other speakers coming up, and we would be delighted to hear more about your the Polar Academy and so on. But would it be possible to just summarise the main points so that we can move on to the next speaker at all?
So if we come to my last slide, please. In effect, we use the Arctic as a vehicle to empower young people, to select military personnel and athletes, with a big factor determining success being this elusive resilience. Thank you.
Thank you, Scott, for that, and apologies for for jumping in there, and I'm really excited to learn more about the Polar Academy. It sounds like a most amazing initiative. But I think you put the spotlight right front and centre there, Scott. You're talking about resilience, and as you mentioned there, mentioned the first community in Canada to be moving lock, stock, and barrel, and that really puts a focus on the subject matter here, mental and physical health, and with reference to people having to move their homes and their livelihoods, what does it actually mean for them with reference to being a displaced community, and the impact and the devastation that causes people on those aspects? So I think it's really vital. It's so crucial that you've mentioned that very good example there, and this issue about resilience. And I hope we can come back to that in the discussion, kind of like going forward. So thank you, Scott, for that. And I just want to move on to our second speaker, Martin. So Martin, if you're there, look forward to hearing your considerations. Thank you, Scott. Over to Martin.
Thank you. I'm just going to share my screen, hopefully. Hopefully folk can see that. So thanks for inviting me along. I'm Martin Malcolm, Head of Public Health Intelligence at NHS Western Isles. And I'm just going to give a short talk on our involvement in a project called ChatPal, which is looking at creating and piloting chatbots for the support of mental well-being. And it's focused around people living in sparsely populated areas, and as it's mentioned, it's sponsored through the northern peripheries and Arctic regions, having, I guess, some of the most sparsely populated areas that you can find. So there's partners. It's led by Northern Ireland and Ulster University, and there's other partners there with Action Mental Health in Northern Ireland, Cork Institute of Technology in the Republic of Ireland, and we have partners more further north in Finland and in Sweden at Luleå Institute of Technology and the Norrbotten Region Council there, and ourselves here in Scotland. There's three main objectives around the project. One of these is obviously to build a picture of mental health and the digital requirements that surround people living in these sparsely populated areas of peripheral areas, including the Arctic. And with that knowledge to then co-create and pilot a multilingual chatbot service, and that will be in English, Scots Gaelic, Finnish and Swedish. And after that, we hope then obviously to increase awareness of these types of digital solutions for mental health professionals, particularly in these remote and rural areas. And the reason we've come together as partners in this project across the northern peripheries and Arctic areas, and we all share these common challenges around mental health, and you can see there. So there's I guess elevated levels of social isolation often in these areas with greater levels of mental health problems. Access is always a challenge physically in a lot of these areas. And that can lead to difficulties in terms of accessing mental health support, which often is needed fairly quickly, round the clock, which can be a difficult challenge. Barriers too, then amongst hard to reach groups, such as older men. And often it can be at the other end of the spectrum for younger folk. We find that difficulty in accessing age-appropriate support that suits their particular needs. And of course, there's always pressures, financial pressures, and health budgets. So can chatbots and technology offer solutions in this space that might get around some of these things? So why indeed mental health, mental wellbeing chatbots? I touched on some of these. Accessibility is a key one. Can they offer that round-the-clock support that perhaps is more challenging in these remote and rural environments? Also, that can the service be easily accessible once you identify and find the service? That needs to be something that's easily accessible, and that can be with no particular overheads in terms of the digital skills and literacy that's required to access these. The software, etc., needs to be pretty easy to obtain and use. Another perceived benefit is around its anonymity. So there's no judgment, stigma that people might face or might perceive in some of our more traditional services that can offer an attraction to some groups of society. And something here called ecologically valid measurements. That simply means the ability through the service itself, the chatbot service, to gather real-time data around the impacts that such a service is providing to the individual. And as I touched on earlier, that's a potential with challenged budgets to explore whether this can be economically more viable as a solution. So the project is organised through 4 work packages. The first 2 are complete, and that was around the needs gathering and then the development of the psychological content for the chatbot itself. The third work package is almost complete, so that's the actual designing of the technology itself, and then we'll be moving very soon into the trials and evaluation. I'll just talk about results from some of these here. So part of that first work package around needs identification, we did a stakeholder survey across mental health care professionals across the four regions. The results that I've quoted here are from a little while ago, so there's probably more. I think this was back towards the end of last year. It's an ongoing survey, and thus far, of those that have responded, there has been a perceived benefit amongst professionals through such a service as a chatbot, and they particularly see the more practical logistical benefits that could derive around easier access, 24/7 availability, that type of thing. They are mindful that there's potential for challenges and risks within such a service, so that needs to be borne in mind in the design, e.g. perhaps the risk of wrongful advice from an automated chatbot service, so that needs to be carefully considered, and the target groups would obviously be a key consideration in that as to who would be using such a chatbot. We did find that the greater the experience of the mental health professional, they were more likely to recommend such a service, which was interesting, and finds that might be that confidence in the service. We then moved on following the survey to carry out across each of the areas, Finland, Sweden, ourselves in the Western Isles and in Ireland, some stakeholder workshops that brought together both service users and those mental health professionals with ourselves. That was really designed to gather some key ideas that would inform the content for such a chatbot service. And it was interesting across the different areas where we undertook this. There were a number of common themes that were picked up, and that ranged from practical things around information, provision of links to resources, goal setting, and the coaching around physical exercises, that type of thing, to obviously some key needs around mental health support content. That included things like guided exercises, which could be mindfulness, meditation, achievement logs, thought diaries, that type of thing. And also some specific functionality was identified commonly across a number of the partners, things like mental well-being scales to see how people were progressing, the ability to monitor mood, again, which should track people's journey through such a service. Digital stories, reminders around users' medications or potential treatment regimes that were on that. So those were the key themes that we found that we then went into designing the content. Alongside gathering that content information, we looked at stakeholders' thoughts around what the chatbot design itself, what were the key aspects of that. And one of the things we're keen to look at was this notion of a chat pal persona. And these were the sorts of things that people were saying to us. They were keen that the chatbot persona was someone aged 30, mid-30s. That was the optimum age range. They wanted the persona to be female or gender neutral, not keen on a male persona. Personality, extrovert, but not overly extrovert, but obviously needed an empathetic and positive outlook. And it could be anthropomorphic or a human persona. Obviously, an intelligence and active support element to it that could convey those factors around conversational response, supportive, that type of thing. Beyond that persona, we also found that people were very keen to see the use of images within the chatbot service that wasn't completely textual, and that would break up the content and add some stimulus. So multimodal outputs as well around charts and pictures and whatnot. It was key that it had a branding so that people became familiar with the chatbot service. So that's been uppermost in that design aspect. So we then took the outputs of the chatbot design workshops, and we've actually put there's a prototype currently available in Google Store of all places. This really was an opportunity, we thought, with the pandemic to just quickly put something up and test out, get some initial feedback around that. So the prototype was quickly put out there on Google Play, as I say. We're now at the point of moving into our full trials. So shortly we'll be looking at some initial pilot trials. We're looking at 30 participants in each of the partner areas, and that we're looking at testing the usability of the service, the onboarding process, how people get on and access, and the language, because it's going to be provided across these different language and cultural contexts, as that all fit. Thereafter, I'm expecting that towards the early part of summer. Thereafter, later in the summer, we'll be moving to full user trials, again across the different partners, and that will be looking more around how the content's received, the mental well-being outcome measurements. Are they sensitive to identifying those improvements, hopefully, in users' mental well-being, and the functionality itself, those things that I mentioned earlier. How are people finding those? Are they what people were expecting? The studies, the trials will have...
Excuse me, Martin, could I just jump in here in the interest of time? I'm just wondering if it's possible just to go to the quick high-level summary, and hopefully we can come back to these points in the discussion.
Yeah, this is really the last slide. It's just to say that we will be moving to the trials, as I mentioned, this summer, and we're hopeful that data collection with those measures that I mentioned in the slide there, and the results will be available later in the year, and thereafter we'll be linking in with our stakeholders again to see if hopefully the positive results can lead to a rollout of this service and how useful it might be in these environments.
Great. Thank you, Martin. Thank you very much for that presentation. And there's obviously a lot of work going into the rollout of that service. And I think the thing that really struck me is the practical nature of what you're doing and achieving and delivering there. And already my mind is thinking back to Scott's presentation on what he'd mentioned about resilience, and it'd be interesting to see how we can perhaps, if there's any opportunities and scope to embrace and look at some of those issues of resilience and how it features in some of these models that are being rolled out. So hopefully we can take those kind of like conversations a little bit further. But for now, Martin, thank you very much for that. And now I'd like to hand over to Anthony Morgan. Anthony, if you're there, then over to you.
Thank you, Zaheen. Zanon, are you going to share my slides? It might be easier. Or I can try to do it.
Yeah, give me a moment. I'll just try.
No, I've got them here. Let me just try to do that. As with other people, I'm more used to Microsoft Teams and Zoom, but let's give it a go. How's that? Can people see anything?
Yeah,
yes, that's looking good, Anthony. Go ahead.
Okay, well, thank you for inviting me to participate in the event. It's a real opportunity for me to actually just share ideas with other people who are not necessarily in your close quarters. So thanks for that. I'm going to be talking about how we might create positive environments for young people's health and well-being, which is the main area of my own research. But to start off with, that is littered through my slides, but I think when Senan asked us to prepare a set of statements which actually reflected the sort of key message, I thought it would be useful to read those out at the start of the presentation. So my main argument around this presentation is that it is well known now that investing in the health and well-being of children and adolescents now is good for their growth and development, but also it's good for their future health-related outcomes and for society as a whole. And in doing so, in terms of those main arguments, I think the key messages for my presentation are that health policy to support child and adolescent growth and development has largely been focused on how to fix health problems. Sometimes this is called, in the public health field, it's sometimes called a deficit approach to health and well-being. Salutogenesis is not a new concept, but was introduced 30 years ago into the health promotion lexicon. There's a way of helping us think about how we might create the conditions for health that actually support young people to thrive. Supporting young people to thrive could be based on a set of values that encourages them to do well for themselves, but also for others, for the common good, as our university mission states. But also, if we're going to actually put ourselves in that position, we've got to actually think about the range of skills and competencies that young people require to do well, and their ability to participate in a range of formal and informal networks for the common good is a core competence that provides a cornerstone for maintaining well-being, even when faced with difficult circumstances. So I think that's a useful starting point to what I've got to say. Now I just find the next. So just a little bit about myself. I was originally trained as a chemist. I did chemistry at university, but I spent most of my career working in the NHS in healthcare. And more recently, well, I moved in a full flood public health, probably in the early 90s. So I call myself a public health specialist by now, but I'm trained also in epidemiology. My PhD I carried out at the Karolinska Institute in Stockholm in Sweden, focusing on how we use the concept of social capital to promote health and well-being of young people. Before coming to GCU, I spent 10 years working in an English institution called the National Institute for Health and Care Excellence, which has the job of actually producing evidence-based guidance on how to actually improve standards in the English National Health Service. In terms of what I'm interested in terms of my research, the population of interest for me is young people aged between 0 and 19, and that's the WHO definition of children and young adolescents. I'm actually particularly interested in intervention research that actually makes sure that whatever research questions I'm asking are actually really tied into real life, and actually we can actually think about how we change things that need to be changed out in our society. I'm also interested, I'm a big lover of theory, and the key concepts that I'll be talking about briefly today are the concept of salutogenesis and social capital. However, it's important to say that resilience, the concept of resilience, features heavily in my work as well. I think it's sometimes we as researchers, we choose to focus on one particular concept or other, but if you look more deeply at these things, then there's a lot of overlap between them. So I think we shouldn't lose the fact that actually what's important is our ability to do things to improve things, and actually in some ways it doesn't actually matter what concept or what label we're using, as long as we're clear about what we're using it for. And obviously today I'm talking about mental health, which is a very complex phenomenon and actually poses some difficulties sometimes in our research. Who are my collaborators? I work closely, particularly at the moment, with the World Health Organization. I'm going to tell you a little bit about something called the Health Behaviour in School-Aged Children Research Network. And I have particular projects with the University of Bergen in Norway and the University of Hampstead in Sweden. In terms of the HBSC study, this is a study that was actually set up around 30 years ago, that actually started with 3 countries, but now has 50 countries participating to collaborate to develop and execute the HBSC survey, which actually collects information every 4 years on young people's health, particularly adolescents of the age group 11, 13 and 15, in order to gain insights into their health and well-being, but actually to understand the social context within which they live, and actually to understand how we can actually provide a better set of environments for young people so that they have the best possibility of thriving, as I said in one of my key messages. And there are countries within the context of this event are included in the survey, such as Iceland, Greenland, all the other Scandinavian countries, and Canada as well. The premise for my research is this is the starting point, and it's about the more that we provide young people with opportunities to experience and accumulate the positive effects of protective factors, health assets as I call them in my terminology, the more likely they are to achieve and sustain health and well-being during childhood and into adulthood. And that's been demonstrated by a lot of research in the past. And the HBSC study in itself actually has demonstrated over and over again, including in the latest international report, that actually most children are satisfied with their lives and perceive their health to be good and do not regularly suffer from health complaints. Meaning then, if we actually take more of an interest in those children who are doing well, then we can actually better understand the conditions that we are required to support all children to do well, even if they're living in difficult circumstances.
Excuse me, Anthony, may I just come in here? I'm just thinking in terms of interest of time. We've got one more speaker still to go. Would it be possible just to go to your concluding slide at all?
Yeah, okay.
Thank you.
I was going to introduce the concept of salutogenesis, which is one of the main ideas that helps us actually formulate our research questions, but I can talk about that in the discussion. And social capital is the other main concept that I use. The projects that might be of interest to people is one of the projects I'm still working with in terms of the University of Halmstad in Sweden is actually thinking about how we develop social capital into a theory, because if we don't have enough knowledge about how to actually develop the theory, then we actually can't actually put it into action, and the application of social capital into practice is really important. The project I'm doing with the University of Bergen is actually thinking about how we strengthen young people's abilities to actually develop their skills and competencies that will give them a better chance in life. And I'm actually also working with WHO to actually think about how we make sure that we can keep schools open in a safe way, so that actually young people can actually maintain their well-being and their progression and development through education. I'm happy to pick some of these ideas up in the discussion. Okay, I'll end there in the interest of time. Thank you.
Yeah, thank you, Anthony, for that. And I think, I mean, that you touched on a lot of key issues, but I think you've put things into perspective with reference to understanding the social context, and that kind of like really relates back to the practical nature of what Martin was talking about with the approach and the underpinning of some of the case studies that Scott's talking about. So without further ado, I'd like to thank you, Anthony, for your insights, and I'd like to hand over to Aria to share with us her thoughts. Over to you.
Thank you very much to give this opportunity to come and give some ideas what we are doing in the thematic network of health and well-being in the Arctic. So I try to share my slides. So here in Oulu, it's snowing and it's around minus 15 degrees outside, and so that my name is Arja Rautio, and I'm from University of Oulu. I'm also the vice president of research in the University of Arctic, and my professorship is in the Faculty of Medicine, and it's in Arctic research. So I'm medical doctor in my training. And in this, you see my face on the right-hand side. So I'm standing in out. And at the moment, the leader of the thematic network, Health and Wellbeing in the Arctic, is Gert Mulvard, and he's from Nuuk, and he's working in the University of Greenland. And Anastasia Melimanova, she is working in Oulu, and she is a vice chair of this thematic network. And I think that our main goal is the safe and good quality of life in the Arctic. And as you very well know, that the Arctic populations, they are not very similar to each other, so that the half of the Arctic is Russia, and 2/3 of the people out of these 7 million people is living in Russia, and 1 million is indigenous. And so that there is a huge health and well-being disparities in the different parts of the Arctic and regions and territories. And of course, there is also the differences in health and access to the healthcare, and also between indigenous and non-indigenous peoples living in the same region, and of course between the rural and urban areas. And I think that the health and well-being aspects, they are the basic elements for facing of any climate, environment, or other hazards. Of course, thinking about the food and water security, safety issues, and of course, in the case of the pandemic or any zoonotic diseases which is coming, I think that that is some kind of background where we are working. And here are some of the characteristics of our thematic network. It was I think that the first one among the first 4 thematic network, which was established under the University of the Arctic. And I was leading this network since 2006 until 2017, when I was moved to the Vice President of Research. And Gert Mulvad, he has been working very long time as a medical doctor in Nuuk. I think that around 30 years. And now he is leading this network. And our focus areas is education and research, and especially indigenous health and well-being is very important thing for all of us. And of course, we try to keep the things that we don't do only the research and education, but we also we are participating the public health politics, or for example, we are very active in the level of the Arctic Council, or our members are active in that different working groups. We have at the moment around 20 members, and those universities and institutes, they are all from all 8 Arctic countries, and of course there can be new members from outside Arctic. And our activities, we had acting, I think that 8 years. It was international master's program on health and well-being in the Arctic. And there were several students which are now very permanent and very good positions in the Arctic research. And at the moment we are focusing on the PhD level education, so that we have different type of courses, and summer schools, winter schools, and we are doing these exercises together with other thematic networks or other health organizations or networks, or we have different collaboration. I think that it's every year we have some kind of the summer or winter school. And that's why, because we are not this is a very big area to be active, and that's why the collaboration with other networks is really needed. In Arctic Council, there are members of our thematic network who are working in the Arctic Monitoring and Assessment Program with the contaminants, Sustainable Development Working Group, where, for example, there are the projects One Arctic, One Health, biosecurity issues, and mental health projects. Very recently, we have also many horizon projects like Nunataruk, which is effect of the climate change on coastal Arctic regions and populations, what are their adaptation and mitigation issues. And we have the case studies in different countries like in Greenland, Russia, North Canada, and Svalbard. And we have also the project, or the members of our thematic network, they are active in the environmental chemicals project and their effects on human health. We have also the funding from the Nordic Council of Ministers. We have earlier for the educational courses, but now, for example, the effect of climate change and zoonotic diseases and the healthy aging project. We were also invited together with Gert Mulvard and myself to the Lancet Commission on Arctic Health and Wellbeing, and that work is now going on. And I hope to show in this only one slide what are the leading principles of our thematic network when we are doing the work. It is a holistic approach of One Health, so that there is a health of human, environment and animals, and so that we are trying to have as broad and holistic view to the health and well-being as possible. We are also using community-based participatory research approach, which means that we take the locals and indigenous people in the early phase when we are planning to have a research project, and we are doing that together. We hope also to have the traditional knowledge included in our work. Research ethics is important, and we are very much trying to tell to the students and in our work that we really need to have ethical principles in our work. And as I already told you, that we have a very much collaboration, joint conferences, activities, funding, and also working in all different levels. And for us, it's also important to have the whole circular world together, so that we have very active participants from Russia. And for the future, I think that the collaboration between the partners in the thematic network is important, and also working with the others. And we have done that very much earlier, and also in the future we hope to do that. And also having these connections to the other organizations and networks in education, research and outreach. And for us, the voice of the communities is really important. And I think that this is my last slide, and I really hope that many of you can also participate in this University of Arctic Congress. And unfortunately, it is now online. But perhaps in the future we can have also the more talks and discussion what's going in the Arctic and what kind of things we can do together. And so thank you very much for your attention.
Thank you, Arla. That was really it's a great summary, and just so wonderful to hear the very essence of partnerships that underpins the success and delivery of what you're trying to do with your thematic network. But I also like the fact that you put right at the bottom on your page there that, you know, it's about the voice of communities that matter. And I think that resonates right across all the other presentations as well. It's so critical, but it's nice to see how it shapes the health and well-being of your thematic network. So I think without further ado, what I'd like to do now is thank everyone for the presentations, and then if we can, swiftly move into the heart of this event today, which is thinking about, you know, with reference to everything that we've heard with mental health and physical well-being, is what are the opportunities that we can galvanize around to you know, push research in a direction that embraces a lot of the social and health related research, and think about perhaps how we can break down some of those silos and embed what we've heard across these other disciplines. So we've got three kind of like questions that we want to try and galvanize around, is thinking about what are those opportunities and how might this be facilitated, and how do we really bring issues of well-being and resilience to the core of shaping our Scottish Arctic research, and what are the lessons and good practice things that we can take forward?